लाइव नहीं हो रहा। Hello. Good morning, everyone. Good afternoon. Thank you, everyone. Thank you. You all made my day with such beautiful wishes. Very happy, but where's my gift? Gift चाहिए, ऐसे थोड़ी होता है बर्थडे, है ना? So the gift is, I want all of you to excel, not just in this paper. Get a rank, that will be a very immediate kind of a gift. I'll be so happy that day. But I want all of you to actually excel in life. ठीक है? Live a wholesome life, not like कि भाई you are sad, you are disheartened, because beta, being BDS in India, right, it is very difficult. You would have to struggle in clinics, then your settlement with life, then you will really have a proper life a little later in. So I just want all of you to give me a gift today, that you all are going to have a very, very wholesome life. You are going to be happy no matter what the result is. ठीक है? If you get a good rank, if you get a seat, government seat, obviously that is like obviously a gift. But beta, my aim is beyond your rank, right? Even when you go to college, you can be sad. Even when you are MDS, you can be sad. But that is what I want as a gift. Never ever lose hope, never ever give up. See, just in the morning I was thinking, long back there was a phoenix bird, है ना, which used to be destroyed into ashes and then again rise. I was just thinking, could there was could have these kind of birds could have been there. I don't know whether they were there or not, nobody knows, but there is some mystery around them. And then suddenly it came to my mind, every single day we are almost destroyed to ashes. Almost something happens that we are not in our mood, and then every other morning or afternoon, whenever we get up again. So I think that mystery bird phoenix is just us, right? All of us, we are doing this. Beta, you can fall n number of times, get up n plus 1. That plus 1 is going to make you victorious. Okay? And of course, again, thank you for the wishes. I'm really happy, and on my birthday I really wish a successful life for all of you. Okay, today is probably the first birthday that I don't really want anything for myself, right? Okay, chalo padhte hain, jaldi se padhte hain. So beta, ready to give me this gift? It's a big gift. Ye mat bolna yes ma'am, we will be happy, we will be like phoenix. Nahi, it is a lifetime commitment that you are going to gift me, that you all are going to be victorious in life. Fine, come what may. See, life is going to throw you actually into sometimes into an ocean, sometimes into a ball of fire, but come out of it. ठीक है? Many students you get disturbed कि भाई सुप्रीम कोर्ट का केस क्या हो रहा है, पोस्टपोन हो जाएगा. होने दो, स्मॉल थिंग. पोस्टपोन होगा नहीं होगा, होने दो. जो होना है, let it be. Right? You keep on doing your own work. Done? So am I getting my gift or not? See? Chalo. Think about it, beta. Give me a gift after you think about it. Okay. Chalo, let us start with pharmacokinetics. Quickly karte hain. Nothing very difficult about this topic. Still, there are certain things which I want कि भाई they should be sorted beforehand. Fine. So beta, this kind of thing, routes of drug administration, you must know what are the various routes of administration. These kind of questions are very new. Fine, very new. So you must know intramuscular injection, subcutaneous, intravenous, intradermal को almost 0 ले लो. Almost 0 to 10. Fine. So beta, these kind of questions will come. They'll give you an image and ABCD mark कर देंगे and they will ask you which is this injection. Fine. So A is intramuscular, 90-degree angle पे it is given. Full needle is inserted. See, full needle is inserted. Right. Then only it can reach the muscle. Both of these are questions. Subcutaneous, 45-degree angle, that is how you reach the subcutaneous. Intravenous में almost you give parallel 25 degrees C, or not C, 25 degrees. And intradermal, remember, almost 0 to 10. Fine. Out of this, very good. Out of this, subcutaneous में self-administration is important. So very recent medical exam had this question, which is self-administered, so subcutaneous, right? Even the insulin that we are using, we can administer ourselves. Fine? Okay. Next beta, this kind of question has come. What is the site of injection over here? It was written A, B, C and D. So they ask you which is the right place of injection, IM injection in this particular position. So it is obviously, you know, B, this portion. Fine. It was a direct question and you should know about it. The other common site is deltoid, right? And in the children we give it at vastus lateralis. Fine. So this question done. Okay, next is prodrugs. इसको अगर भूल गए then तो बेटे जी problem. Fine, what is the problem? Prodrug आता ही है. It is something that you must know. All prefer doing MDS in clinicals. This is your mnemonic. If you have another mnemonic, that's okay. But remember, ACE inhibitors except captopril and lisinopril, PPI. I'm really sorry, this phone. No. PPI and prednisolone, dipivefrin, methyl dopa, minoxidil, 6-mercaptopurine, levodopa. This you can forget, no problem. Clopidogrel you cannot forget. Carbimazole, sulfasalazine and salindac. So beta, these all are always in the question. Always, always. So if you have not learned, please learn it right now. Fine. Right now you learn what are the various prodrugs. So they always ask you. Fine. So please note clopidogrel, levodopa. Direct question comes. Fine. Any question can come, beta. So any drug they can ask you. The majority ones they I have marked ACE inhibitors and levodopa also has come. Clopidogrel. Fine. Okay. Now let us start with pharmacokinetics. You know it has ADME. ADME is absorption, distribution, metabolism, excretion. Pharmacokinetics is what? Who will tell me? Is what? Is it what drugs do to the body or what body does to the drug? What is pharmacokinetics? Quickly answer bete. Jaldi say. Direct simple question. क्या है pharmacokinetics? See how I have remembered is pharmacodynamics. So drug. Whatever the drug is doing to the body, that is dynamics. Fine. Next, remember the steps which are there in pharmacokinetics. Then beta, it is always asked where should the acidic drugs be absorbed mainly. So acidic beta, when the medium, just remember one line, when the medium is same, then you know the crossing over occurs. So acidic in acidic medium, they are unionized, right? And they are lipid soluble. That is why they cross. So simple rule है, medium and drug should be same. ये याद हो गया? बोलो जल्दी से बेटा. एग्जाम में ना you won't remember this chart. You cannot remember this chart, but you can remember medium and drug. If they are same, then it is the solubility is lipid solubility, and it can cross. Fine. So basic, in basic unionized, lipid soluble, cross. Acidic in basic ionized. So ionized is always water soluble, not. So beta, acidic drugs should mainly be absorbed from stomach and basic from the intestine. But see, lipid solubility is a very, very important criteria. But beta, because of the surface area, maximum drugs are whether acidic or basic, they are absorbed from the intestine. Acidic drugs like aspirin and basic drugs like morphine. Right? So you must know this. Done beta? I hope you can do this. And beta, this even question can come when the medium is what? Same. Then is the drug ionized or unionized? So this chart, if you know this line, it will be done. Fine? Okay. Next. Weak acids and weak bases. Sometimes they will give you acids. Sometimes they will give you the name. Right? So let us learn. First thing is you have to know in the acid, NSAID, aspirin. This is the question. Simple. Next is barbiturate. You have to know it. There is no, escape if you don't know these two terms. In the weak bases, if you see very, sharply, if you ever forget, morphine to yaad rakhna hi hai. Every drug has IN or INE in the end. है ना? So INE याद कर लो. It is a very layman kind of a mnemonic. But if you forget which is acidic, which is basic, INE वाली जो drugs है end में, they are basic. Fine. This particular information is important for the INI. There they ask you all this stuff, but you must know beta. I think by now you must be knowing this. If the pH of the medium is equal to the pKa, then the drug is 50% ionized and 50% unionized. Fine. So this particular chart I am leaving to your sensibilities that you learn it. Fine. When pH is equal to pKa, 50% same होते हैं, ionized and unionized. When pH minus pKa is 1, one form is 90%, the other is 10%, depending upon acidic है या basic है. Fine. So this particular chart I am leaving to your sensibilities so that you can just revise. In the NEET, इसमें से very less chances of coming, the question का coming is very less. Fine. But you don't know what the examiner can give you. So just revise it. Okay. Next is bete bioavailability. So what is the takeaway point? You must know, beta, you must know the angulation of the various syringes. Recent question. You must know IM sites. What are the majority, IM drugs, where they are given? Deltoid, or they are given in the gluteus, or in the children where they are given? Right? They might give you infant ka photo and they will give you 4-5 sites. Right? And they will mark it and you would have to identify. So that is one takeaway point. Second, you have to know beta acidic basic drugs. Fine? Very important. Okay. Next is bioavailability. I hope you know what it is. Right? I don't have to teach you. But it is that portion which is actually coming for usage. Right? Now, the bioavailability determines the dose. If suppose a drug has high bioavailability, उसका low dose हमें देना होगा. Low bioavailability, high dose. Right? Factors which affect, you all know. Maximum bioavailability is of the intravenous. Right? Why? Because first pass metabolism avoid हो जाता है. Right? So, when the first pass metabolism increases, then bioavailability decreases. Right? And when the absorption increases, bioavailability increases. इसमें confuse नहीं होना है. Just apply your logic and just know the dosage. Okay, this is a newer question for you, right? Majority of times first pass metabolism and bioavailability connection has been asked. Fine. Then this, drugs with high first pass metabolism. Nitrates have large pre-systemic metabolism. Again, I am telling you, you have your own mnemonic. That's okay, revise it. But the point of this lecture is you must be aware of all of this. Fine. Next, first pass metabolism किस किस का होता है? You must know. Nitrates, hydrocortisone, lignocaine, propranolol, salbutamol and morphine. Right, that is why nitroglycerin is given sublingually, right? And because it has high first pass metabolism. In the sublingual route, like the IV route, there is no first pass metabolism, plus it is fast acting. It can be self administered, and once the action is complete, the remaining drug can be spit out. Fine. So all the 4 reasons you should know, because in the question directly this has been asked. Okay, why sublingual route is preferred for the nitroglycerin? Done. Take 1 second, learn the first pass metabolism drugs which are having high first pass metabolism. Take a second and learn it. Okay, let me just open this slide so that you can learn it. See beta, the purpose is, after today, pharmacokinetics say you should never make a mistake. That is the only purpose. I am not teaching you pharmac, but I am telling you from the journal pharmac, there are going to be 2 or 3 questions. Pharmacokinetics, pharmacodynamics, from therapeutic index, from जो हम करते हैं, the surveys that we do, है ना? All that kind of thing can come. Okay, now what is this? This is a chart. How do you calculate the bioavailability? To calculate the bioavailability of a drug, we give it IV and orally. We plot the graph and we find the area under curve. Fine. So the area under the curve gives us how much, the extent of absorption of the drug is. Fine. Okay. Next is, so bioavailability beta is, agar if they ask you, वैसे तो I don't think so they'll ask you in NEET, but if they ask you, it is AUCO by AUCI. Right, you plot these 2 graphs together and then you find out bioavailability. This is the formula. INI के लिए important है, NEET के लिए I don't think so. Right, but they might use the term AUC. Okay. Next is, just give me 1 second, I'll open up the live chat to see if any problem is there. Okay, no problem. Fine. Okay, next is lip distribution. See, in the distribution, please remember lipid soluble drugs will have higher distribution. Fine. Any drug which has high plasma protein binding will have low distribution. And here acidic drugs bind to albumin. Again the question will be aspirin binds to what? Fine. So acidic drugs, basic drugs ka full, the drugs should be on your tips. At least 4 5. Basic drugs bind to alpha 1 acid glycoprotein. Now when the plasma protein binding is high, right, then what all happens? First, volume of distribution, that means the drug in the tissues is low. Very important, this chart is very important. If you have not learnt, then please note it. ठीक है, direct question आता है. Next, if plasma protein binding is high, duration of action is high. If plasma protein binding is high, then displacement reaction chances are high. For example, I told you sulfonamides and warfarin, they increase bleeding. Why? Because when given together, sulfonamide will, displace warfarin from the plasma protein binding sites. Right? When PBP, that is plasma protein binding, is high, filtration is going to be less. Why? Because plasma proteins are not filtered. If plasma protein binding is high, dialysis cannot be done. Right? So beta, these 5 points, they are very important. Fine beta? Done? Just giving you a second. Please कर लो, जल्दी से इसको learn कर लो, so that again you don't have to do. Just giving you a second. Okay. Next is barriers. You must know where the blood-brain barrier is absent, the circumventricular organ. You know, this question has come many times, or at least twice. Circumventricular organ is the site where the blood-brain barrier is absent. Fine, just this much. Some drugs cross blood-brain barrier, some don't. You remember from the tuberculosis we have done the drugs. So remember, you know, immediately कि भाई I have to revise the tuberculosis wala drug. Fine. Okay. Then dialysis. See, drugs with high plasma protein binding, they cannot be filtered like diazepam. Drugs which have high tissue penetrance or high volume of distribution, they also cannot be, you know, treated by dialysis. The poisoning like digoxin and propranolol. So, what are the drugs which are apt candidate for dialysis? Drugs which have low volume of distribution, low plasma binding protein, plasma protein binding capacities. Fine, like salicylates. Again, a chart from GRG book. Again, they can ask you this. Which drugs may we will do the dialysis, in which drugs we don't do. So, dialysis is not effective in the poisoning of avoid dialysis drug. Avoid dialysis. Amphetamines, verapamil, organophosphates, opioids. This you can forget. Digitalis is important. Diazepam is important. Right? So, in this beta, questions have come on diazepam. Questions have come on aspirin. Okay, by aspirin, will you do dialysis or not? Yes, we will do it. Fine? Okay, next, volume of distribution. You all know what it is. It is when the drug enters tissue. Simple. Right? These formulae, I don't think so NEET mein aayenge. Till now, they have not come. So, don't waste your energy in learning. But if you know it, then it's okay to revise. Fine. Then, it determines loading dose. This is a very important question. Loading dose depends upon volume of distribution, whereas maintenance dose depends upon clearance. Which is that drug with maximum VD? Chloroquine, and it is mostly distributed in liver, but the site of action is RBC. Right, but this question has also not come. It used to come in the KSET and the Comet K. But these questions, what determines what? So, beta loading dose में VD है and maintenance dose में clearance है. Right, how will you remember it if you ever get confused? Because in the exam you can get confused. Right, so load da VD da. ठीक है, ऐसे याद रखेंगे. Fine. Okay. Next is metabolism. Primary site is liver. The main aim of the metabolism is to make the drug water soluble. Right? Or it can do active to inactive, active to active, or inactive to active. So why I have added this in your revision? Because, you know, once a question came, what is the purpose of metabolism? So even active to inactive, active to another active component, or pro-drug to active, right? So that is the function of metabolism, and I have discussed with you the pro-drugs which you cannot make a mistake. ठीक है, ये बहुत सारी हैं. That is why in the beginning only I gave you few which are very important. Fine? Okay. Next you must know phase 1 reactions and phase 2 reactions. Just let me open it nicely. Yes, so phase 1, we add a functional group. Here in the phase 2, we add the conjugates. In phase 1, the drug may be water soluble or lipid soluble, but by the end of phase 2, the drug will become water soluble, because the main aim is this. Fine. Then microsomal enzymes or non-microsomal enzymes are used in the metabolism. Microsomal enzymes are present in the smooth endoplasmic reticulum. Non-microsomal are outside. Microsomal can be induced or inhibited, and microsomal participates in most of the reactions plus the glucuronidation reaction of phase 2. Right. So all the phase 1 reactions are under microsomal enzymes control. Very important point. So beta, if I really have to highlight one thing from this particular page, it is going to be these two things. What is the function of phase 1? What is the function of phase 2? Rest of the things, if you know that phase 1 is mostly catabolic, phase 2 is anabolic, that is secondary. If you know it, very well. If you don't know it, at least know these two things. Fine. Giving you a second. Learn kar lo abhi ke abhi. And if the examiner wants to go into depth, then he will ask you which can be induced, which cannot be induced. But in NEET, the paper is going to be very easy. Fine. Okay. Next, enzymes which are involved in metabolism. You must know the microsomal and reactions. So all the phase 1 reactions like oxidation, reduction, hydrolysis, they all are phase 1 reaction, right? Yet this particular point also you should know. Okay, what are the phase 1 reaction? So oxidation, reduction, hydrolysis and cyclization, they all are phase 1. phase 2 में कौन से होते हैं? Glucuronide conjugation, right? Glucuronide conjugation, acetylation, methylation, sulfate conjugation, right? And all the reactions of phase 1 are microsomal, plus the glucuronide conjugation is also microsomal. Fine. All other phase 2, they are going to be the non-microsomal. Fine. Most common phase 1 reaction is oxidation. Most common phase 2 reaction is glucuronide conjugation. Fine. Important questions. If you have not done, then beta, these please do. Most common phase 1 oxidation, most common phase 2 glucuronide. Glucuronide is also microsomal. Phase 1 is also microsomal. Yaad hai sabko? Okay, very good. This point I have done. Again I am repeating because beta I don't want you to make a mistake. Enzyme inducers, enzyme inhibitors. ठीक है? याद नहीं है? Again, do not go to the paper without learning this. Fine. And this also. Anti-epileptics are what? They are enzyme inducers except valproate. Antibiotics are what? Enzyme inhibitors. So erythromycin is enzyme inhibitor except rifampicin and griseofulvin. And this question, beta, warfarin interactions which we did in the last class, very important. Fine. So when I increase dose, when I decrease dose, what is the drug added? Any kind of combinations can come. And I hope now you will never ever make a mistake. Fine. Okay, so this I have done already. This chart you must know. This is the question I was talking about. Here in phase 1, most common is oxidation. Right? It can be both. Phase 1 can be both microsomal and non-microsomal, but majorly microsomal hi hota hai, right? And even this glucuronide is microsomal. Rest all are non-microsomal. Fine. So this is again revision. Okay. Next, beta, this point, cytochrome P450. So what is this? Cytochrome P450 enzymes. P is for pigment, right? P is for pigment which maximum light is absorbed at this particular frequency or wavelength. And CYP3A4, like for example, let us see, 3 is the family, A is the subfamily, and 4 is the isoform, right? 450 is the wavelength of light at which maximum absorption occurs. Wavelength. Fine. Okay, in this beta, what you have to know. First question, most of the drugs are metabolized by CYP3A4, then second most by CYP2D6. ये repeat question है. Which of the following enzymes is forming the second most common, pathway? So CYP2D6 you have to remember. These two only you remember, right? CYP3A4, say if they ask you drug, then CT scan. Cyclosporin, tacrolimus, statins, cat drugs, cispiride, estimazole, terfenadine, amiodarone. Right? CT scan आप याद कर लो बेटा एक बार. And inducers and inhibitors you all know. But one I want to highlight is grapefruit juice. Right beta? So grapefruit juice is an inhibitor. It is not an inducer, inhibitor. So obviously you will not give it with the CT scan drugs. Right? So grapefruit juice is something that has come in the MCQs. Okay. Next, 2D6 may you just remember beta blockers, most beta blockers, and you remember the SSRI and MAO inhibitors and tricyclic antidepressants. So basically beta blocker and again antiarrhythmic maybe and antidepressants. Right? 2C19, you remember substrate is omeprazole, right? And then inducer inhibitor, no need to know. Next, 2C9 is important. Why? Beta, why? Because C आप ऐसे याद रखोगे, clotting. So clotting drug, warfarin. And 9, if you just reverse it, it looks like P. So phenytoin. Just this much. And of course the interactions, so you know. Right? So warfarin and phenytoin, remember 2C9. That's it from this chart. You remember 3A4? 2D6 is only for the depressants and the beta blocker, antidepressants and beta blocker. 2C19 omeprazole को याद रखेंगे and clopidogrel को maybe याद रखेंगे, right? And 2C9 को कैसे याद रखना है? Phenytoin and warfarin. Most of the enzymes are metabolized by, again I am repeating, CYP3A4. Then second most common is CYP2D6. Fine? Okay ji. And CYP2D6 is all the antidepressants and all the beta blockers. Rest nothing to be learned from the table. Okay? Nothing. Just remember what I have told you. Bad day questions beta, anything can come. For that, how can I say anything? Okay? Next. Okay. Excretion. Let us do excretion. See, most drugs are excreted by the kidney. Right? But lithium is excreted by the sweat. So I hope the lithium wala interaction was clear. Usme kya tha beta? Hyponatremia, dehydration. Hyponatremia agar ho raha hai, then it will trigger the lithium toxicity. Okay? So please make it correct. And lithium toxicity, lithium बहुत important drug hai. Right? So please read lithium. Okay. Next are, see, in this please remember, for the weak acid, not just acid, weak acid, we do alkalinization of urine. Right? I hope you know the concept. Why I am alkalinizing the urine? Because beta, when the medium is same, suppose there is one acid drug and you know aspirin. Hai na? When you know acidic drug, and again if the medium is acidic only, what will happen? The drug can be reabsorbed. In poisoning, I don't want it to be reabsorbed. I don't want it to become lipid soluble. So alkalinization is done. Fine. For the weak bases, you all know, it is made acidic. So acidification of urine is done. Very, very important point. Fine. Next bete, you must know, see, the glomerular filtration, tubular reabsorption, everything and secretion is almost like same. So if I ask you, where is a drug maximally secreted in the nephron? ये मुझे आंसर चाहिए. कोई भी ड्रग है, ऑक्सैलेड, ये blah blah blah, where if it has to be secreted, where it will be secreted maximum in the nephron. ये आंसर तो देना पड़ेगा, अदरवाइज तो फिर क्या हो जाएगा, गुस्सा हो जाएगा. यस डॉक्टर आयुष जैन, मतलब कंटिन्यू करना चाहिए, मतलब सॉल्ट को हमें स्टॉप नहीं करना चाहिए. फाइन. नेक्स्ट इज हाफ लाइफ, टाइम इन विच, वेरी गुड. सो बेटा यू नो इट, ठीक है. पीसीटी में मैक्सिमम एब्जॉर्प्शन, मैक्सिमम दिस थिंग, वाटर भी एब्जॉर्ब होगा, यही क्वेश्चन नीट में आएगा. दे आर नॉट गोइंग टू आस्क यू द एक्सेप्ट क्वेश्चन, ठीक है. नीट पेपर इज वेरी इजी provided you know it. Like they have told you directly, examiner has told you already, I am going to give you achondroplasia. Do you know achondroplasia? He is going to give it. Autosomal dominant है, recessive है, X-linked है, he is going to really give it. Then what will you do? Then Marfan syndrome I am going to ask you, right? If you don't study it, then whose fault is that? Examiner has given you everything. I am going to ask you question on diabetes mellitus. If you don't know, then beta kya kare? He has already told you nephrotic syndrome I am going to give you, right? Then he has already told one question is going to be from liver, and that too from the conjugated unconjugated bilirubin, obstructive or some liver enzyme. One question is going to be from hepatitis B, ठीक है ना. Examiner is also scared to go till hepatitis C, right? Examiner also doesn't go there, you know, he will always give you hepatitis B. So if you have not studied the important topics, then beta who is at fault, right? Chalo. Next, half life. It is the time in which plasma concentration of the drug becomes half. So beta, such kind of questions they can ask you. T half of a life is 6 hours. So after after 24 hours, how much drug remains? Jaldi se answer do. How will you find out? Quickly. Don't use your pen or pencil. Apply your brain. Exam hai ho raha hai. Exam mein you have to quickly apply your brain. See, to my daughter, when I am teaching her maths, I tell her always to do the opposite. I tell her to write, right? Because she is in a learning phase. To you, I am saying don't use pen and paper. You know, do it, calculate in mind and tell me the answer. Yes beta, कितना बचेगा? How much of the drug remains in the body? I have asked. How much? Second question they can ask you, how much of the drug is eliminated from body in 24 hours? So 2 questions are there and you have to give me the answer. Yes beta. Very good. Very good. So beta, remains कितनी हो गई? 6.25%. Eliminated कितनी हो गई? 100 minus 6.25%. Right? Such small calculations के लिए keep your brain ready. Okay? With the T half, you can calculate the dose interval, but not the dose beta. Dose calculate करने के लिए तो we need bioavailability. Right? And then what is steady state? Steady state is a state at which the rate of administration of drug is equal to rate of elimination. See beta, nowadays, you know, they are asking you the definitions. That do you know what it means? And it is approximately 4 to 5 half-lives. Fine. So steady state kya hai? They will ask you. Vital capacity is what? They will ask you. They are not going to ask you how much is vital capacity. Fine beta. So concentrate in the last month on these things. Last 10 days maybe, just have a read on the values. But you must know the definitions, especially of the respiratory values, vital capacity and tidal volume. What is FEE1? You must know. They are not going to ask you the value. Okay. Next. Okay. In tubular secretion, remember probenecid and penicillin interaction. You know it, right? How the action of penicillin is increased because duration is increased because probenecid prolongs the penicillin action by inhibiting its tubular secretion so that penicillin doesn't come out in the urine. Fine. Rather, it remains in the body. Simple. Okay. Then TDM is one important topic I want all of you to learn right now, today only. Order of kinetics हम करेंगे, but TDM पे बहुत questions आते हैं. What is this therapeutic dose monitoring? So why do I do that? We do it for the drugs which have low therapeutic index. Right? Why I have done this question here? Which have low therapeutic index. Low therapeutic index matlab, please, for the therapeutic index, remember the mnemonic TILE. TILE. Right? So, you always get confused. Effective dose 50 by lethal dose by effective dose. So, TILE याद रखना है. Right? जैसे help एक mnemonic याद रखना है for the जो हम करेंगे कल करेंगे pharmacodynamics में, उसके लिए help. So, 2 mnemonics I am giving you. Right? Next, please remember TDM is required for repeat question है बेटा ये. Repeat. Aminoglycosides, always it is asked. ठीक है? But yes, please remember other drugs also. Digitalis, phenytoin, lithium, tricyclic antidepressants and immunomodulators like cyclosporin. Fine. Why? Because their lethal dose and effective dose, they are together. There is not much difference. Fine. So that is why they have low therapeutic index. So learn these drugs and isme aminoglycoside. When we are doing the revision of antibiotics, there again this TDM will come. So which all drugs require TDM? Very important. Done? Okay. Then beta order of kinetics. Okay, order of kinetics I hope you know. Where what is important, जैसे question आ जाता है half life is constant where? First order. Right? Whereas in zero order, constant amount is eliminated. Fine? Here in the first order, clearance also is constant. So clearance and half life is constant in the first order. Most of the drugs follow first order kinetics. Fine. Any drug at higher concentration may show zero order kinetics. If enzymes are abundant, first order. If enzymes are the limiting factor, then they follow zero order. Fine. So this all you should know. Fine beta. So this is the question point number 4 that has been asked. First order kinetics, zero order kinetics. Please remember at least the ones that I have rounded up. Okay. Next. These are the drugs which follow zero order kinetics. What power? Right? I think you know all of this. Warfarin, heparin, alcohol. So alcohol, warfarin has been the question. Theophylline, tolbutamide, phenytoin maybe can come. But alcohol and warfarin you cannot forget. So at least learn alcohol and warfarin. बाकी नहीं याद आ रहा है या नहीं याद है, that's up to you. You have taken 70%, you are through, 30% chance you are taking. But if you don't know alcohol, warfarin, phenytoin, then to beta there is no point. The question will come, alcohol follows what? And you get confused. Right? Okay. Next. Okay, this is it. So beta this अच्छा बेटा, और इसमें ना just don't go into the value based questions. Not much will be asked. Direct concept based they are going to ask you. Fine. If it was INI, they would have asked you first order में 100 थी drug, then first half के बाद क्या हो जाता है, that we will do when we are near INI. But for NEET, know the concept. Where is half-life constant? Where is half-life is less at lower concentrations and more at high concentrations. Fine. So just revise this. Okay, beta. Tomorrow I'll meet you with pharmacodynamics. Till any announcements are made by the Supreme Court, daily pharmac करेंगे, finish करेंगे, ठीक है? And tomorrow you have your medicine class also, and we'll finish medicine CVS, ठीक है? चलो, go बेटे. Thank you, and give me my gift. Right? Become very strong in life. See this I am saying, and Dr. Amit would be laughing. You know, if he hears this thing, he would be actually laughing in the next room. Okay, she is telling about being strong. Yes, I'm strong. Obviously, why? You know, because I am like a phoenix. So you also become like a phoenix. Okay, bete? And nothing should bother you. Supreme Court है, ये है, पढ़ते रहो बेटा, ठीक है? That is the only thing. Bye, bete. Any doubt? Those people remain. Else, please go. Please go. Don't waste your time. Don't be online. Okay? If you have any doubt, then please. डॉक्टर प्रेरणा, एपीपेन के लिए ना एससी और आईएम का है, पर आईएम को ही मार्क किया जाता है. बट यू नो, इन योर ओरल सर्जरी बुक एंड स्ट्रीम नहीं करना है. ओके. But there is one question, you know, for you don't look at the IM or the SC when somebody is in emergency, right? You don't look at it, you just put the shot. You just put the shot, and most of the time it is SC. But what the books will say, कि IM cut. But SC subcutaneous होता है, right? Most of the times. Surgery. Dr. Shivani, I will, you know, you by now you must have understood that surgery is something very, you know, I think it's very complicated kind of subject, right? And surgery mein, even the examiner is very complicated. I think he's really frustrated person, frustrated doctor. I don't know, maybe he's not getting to do surgeries. Maybe, you know, that is his, you know, frustration. So in the exam, you know, he will give you surgery questions. Suppose 7, 8, 10 questions are coming from surgery. He will give you like 4, 5 questions which you can solve. Then the rest of the questions he will directly put from the medical paper, as if he thinks we know about the medical procedures and we know about everything, right? So that is why it becomes a very, you know, twisting kind of subject, because you are only able to do 50% of it. So surgery is one subject. I can help you cover 50% of it, right? And even if I do rest, nobody knows from where they ask you. They may ask you some leg surgery, or they may ask you some, you know, procedure they will give you. I don't know what. They'll click a photo and ask you, what is this? Right? So surgery, I can help you with 50%. That is the only maximum score one can get. Right? Like in pharmac, you can do 100%. Pharmac 100%, medicine 100% score. Then your physiology also, you know, 100% score. Oral path 100% score. Right? Prosto is one such where, you know, they will give you some theory, something. They will like really, you know, spoil your, you know, calm and everything, calmness. They will really spoil it in the paper. So don't bother about it. Maybe from some study they have asked that question. Ortho mein they might give you something. Right? So ortho, prosto, surgery, these are the things, you know, where you cannot have 100% score. But beta pharmacology, that is why I am taking pharmac. 100% score आता है बेटा pharmac में, 100%, because यही question है और question ही नहीं है. Even for the medical people, medicine 100% score. No, Dr. Ishav, I have not studied all the subjects. I am just trying to, you know, really make you perfect in few of the subjects, ताकि आप concentrate करो dental में. right? Because dental is something which is obviously, very scoring for all of you. You know it. You know, dental में oral pathology, oral medicine, if you have not done, what can I say, bete? Suppose somebody is there who is weak in oral pathology, OMR, what are you doing? Please, oral path, OMR, pedo, to some extent endo, right? Perio, they are 100% scoring. 100% score here, beta, so that you can make mistake in surgery, so that you can make mistake probably in your other difficult subject like ortho and prostho. Fine. Oral surgery is also, if you have studied, you can do 80% of the questions very nicely. You can do, right? Rest 20%, obviously, because they are making the exam, they have to give you some googly questions, right? So beta, concentrate on the 100% wala subject. Medicine, OP, OR, pharmac, they should be like perfect. Cool. कबीर, डॉक्टर कबीर, फॉर्मल स्केड्यूल जो है वो मुश्किल हो जाता है, बिकॉज आई हैव मैनी थिंग्स टू डू, राइट? बट डेली आई एम गोइंग टू कम. शेड्यूल नहीं करेंगे, उसको आराम से करेंगे, ठीक है? उसको धीरे धीरे आई हैव स्टार्टेड विद जर्नल पैथोलॉजी, सो आई गिव यू अ शेड्यूल, right? Most of the time I am like you. If I make a schedule, I am not able to follow it, so I've stopped making a schedule, right? I am exactly like you, okay? Like many can follow, like Dr. Amit can make a schedule and follow, but beta, my daughter has exams and I have made schedule for her, which I am actually changing every second day, right? So let us not make a schedule and just finish. Okay, before exam, my pharmac, patho, micro, medicine, physio, and your even anatomy a little bit can be like 100%. Fine? Okay, beta. आज नहीं, कल है. आज आपका क्लास है ना बेटा, डॉक्टर मुस्कान? सो कल है. कल CVS करेंगे, परसों CVS खत्म कर देंगे. फाइन? यस डॉक्टर प्रीता, होल माइक्रो कराऊंगी, डोंट वरी. अभी बहुत टाइम पड़ा है. जब हम डेली मिल रहे हैं तो हम करेंगे ना, माइक्रो भी करेंगे, सब कुछ करेंगे. वी आर मीटिंग डेली नाउ. फाइन? गो बेटे, गो गो बेटा. वेरी गुड. ठीक है, अगर सर्जरी में प्रॉब्लम आ रही है तो बेटा सर्जरी, ठीक है, I'll think and try and take it. Okay, bye. Good day. अमित, क्या करना है? सेशन एंड नहीं करना है? एंड स्ट्रीम